Burjeel Holdings are one of the biggest private healthcare companies in the UAE, founded in 2007, and are one of the leading private healthcare service providers across the MENA region, providing the highest standard of healthcare delivery and patient management outcomes across a network of hospitals, medical centres and pharmacies. The company, like so many others, were forced to adapt during the COVID-19 pandemic and embrace new, disruptive digital technologies. They have utilised the power of the cloud to transform patient experience across the UAE. As part of our Mission Critical Master series, we spoke to the Chief Information Officer of Burjeel Holdings to find out more about their transformation journey.
As you know, Burjeel Holdings is one of the largest private healthcare companies in the UAE with ambitions to grow and provide healthcare to all sections of the population. Okay? In the backdrop of that, just when the COVID was actually at its peak, we started our digital journey. That is to say that what was once a closed systems of record, we were actually beginning to open up that for patient access, patient experience, and so on. Right? So what we decided was to put these new applications digitally accessible to the patients on the cloud first. Right? Before we actually touched any of the existing core systems onto the cloud, we decided to take a path where we wanted to put the newly developed digital applications on the cloud. Right. So that was the first decision that we made. Essentially, we had to achieve three objectives in that program. One was, technically speaking, the three objectives. One was to migrate to the cloud, of course, using the cloud infrastructure as a service, components of Azure, as a modern infrastructure, scalable infrastructure. That was one objective. Secondly, we also upgraded our system at the same time, to more recent software of EMR. And that was the second objective. And the third objective was we also upgraded our database, to a more modern database. So all these were combined in that program, that we achieved in a little less than 5 months time frame, right, last year. So it was successful. There was a lot of learning, and now with the digital applications being successful and having learned how to operate cloud, because cloud requires a lot of change in the organization. It requires a certain adoption. In our experience, we had to take the business stakeholders, management, operations, clinical users along the journey. It was not a simple technical migration. Cloud requires the entire organization to be behind that change agenda. And that's exactly what we did, and we are looking to do more on the cloud as we go forward. Doing this program to ultimately benefit the end users, right, and the business. So first and foremost, growth was an important agenda, right, the business growth. And in our case, healthcare facilities, we were beginning to expand geographically. We are beginning to take on more and more O&M operations and management responsibilities. So growth came from different dimensions, which means we needed a trustworthy, a scalable, robust platform on which these new businesses can be onboarded. So growth was very important agenda. Secondly, of course, the ongoing and continuous consistent patient care, right? With good systems being put in front of the physicians and clinical caregivers, we wanted to ensure that the EMR helped them in their caregiving activities. So that was the second reason. Third also was cost, right? Obviously, cloud allows us to move from a one-time capex into more of an opex model, right? And that was a big change for the organization, right? It was used to heavy capex investments in the past. Now cloud actually changed that, and that's actually a very good thing, right? So from a heavy capex investment, we moved into more of a subscription, pay-as-you-go, and more of OPEX model. And most importantly, right, the reason we went for cloud also was because of the innovations that are happening in the cloud. Right, we wanted to participate in those innovations. So we have already use the three stacks of the cloud, right? Infrastructure as a service, platform as a service, and now increasingly software as a service. Now there's a tremendous amount of innovations going on there, and we wanted to take advantage of in our cloud journey. Was a very big program, for the group had not undertaken a project of this nature in the past, right? Especially within a given, short time frame, right? We did not have the advantage of 12 months or 18 months for this project. We had to do it in 6 months, and we actually ended up doing within 5 months, the project. So that was, the change. And taking the organization along, on this cloud journey was a big challenge, right? And we adopted multiple ways and many ways to overcome those challenges, right? Communication was key. We had to educate a lot of our business stakeholders, and they were very keen to understand, what does it mean if our data is on cloud, is it secure, patient's information is going to be on the cloud, who is going to manage that, So there were a number of questions and number of clarifications that we had to go through. So change was a big challenge, as in any transformation program, right? And so we did have many programs to address that. Secondly, more technically in the migration path, what we call as the cutover window, was actually a very big challenge. If hospitals don't have this system, HIS, EMR, even for 3 hours, patients are going to suffer. Clinicians are going to suffer, operations is going to suffer, right? This is a bloodline of any hospital. So even for 3 hours the system is down, the hospitals cannot operate. But for this project, it required us to take a 24-hour downtime. And that was a very big challenge. And lastly, cloud was, again, as I said, new to the organization, new to the IT department, and therefore operating the cloud environment, was new. So we had to set up a new team, train a lot of our resources on the cloud management and operations, and that had to be planned very carefully, right? And we had good partners. Cloud4C is one of them, who helped us with the cloud managed services, behind it. But it did require us to stand up a team, who understood, how to build pipelines and DevOps. Operations and management on cloud. So this was the new thing that we had to learn, and we had to be ready when the system was on cloud to manage this. So that was another challenge that we had to overcome. But overall, it was a great experience for the team. We had partners like Cloud4C and Microsoft, but a lot of teams came from our internal staff, right? And it was a great learning experience for them. So overall, it was good. One of the immediate benefits that we had anticipated and we had worked towards, in this transformation program was the user experience, the stability, the robustness of the system, and providing a platform for growth, right? Now, additionally, we knew that we were sitting on huge amounts of very valuable data for a number of years. Now, we had not necessarily leveraged it, and built what is today known as AI-based dashboards and AI-based operations. We were not even ready for that, right? And cloud really helped us unlock the value of data, which we are beginning to do now. Now, Cloud4C clearly was a very, very significant and a critical partner in this journey. We continue to work with them as our cloud managed services provider. They were already present in the region. They had huge experience in dealing with cloud transformation as well as ongoing management projects in the region for customers in the UAE. So that was a big plus, and they have very good processes, people, training, that goes along with the managed services provider. So we had chosen them 2 years ago. We worked on them in this particular cloud migration project. Now, in this project, we used them. They provided us essentially on two things. One is they helped us design the landing zone on the cloud, for the migration of this EMR system. Secondly, in the migration activity, the actual cutover and migration, C4C played a significant part. So they were partners, key partners with us, in this program, without whom we couldn't have achieved the timeline or the other objectives, of this program, and we continue to work with them.